A very good evening and thank you so much for joining us from wherever you are watching from in a very special National COVID-19 Come Together moment. Now, after a full year, the COVID-19 pandemic is still here. In fact, it is still getting stronger. Over the last 7 days, Uganda has received 1,300 COVID-19 cases. Let me repeat this for emphasis. In just 7 days alone, we have received 1,300 COVID-19 cases.
Now, in this syndicated bulletin across all media platforms, experts tell us that ICUs across the country are filling up fast. They also tell us that this virus is especially affecting young people.
Now, to overcome this, we all have to do our simple part of following the standard operating procedures. These are maintaining a social distance, wearing a face mask, and sanitizing your hands with water and soap.
And now, most importantly, get vaccinated at the designated health centers. Tonight, in a special joint broadcast from the National Referral Hospital in Mulago, we bring you stories from across the country on the fight against COVID-19. Good evening, I am Rita Kanya.
And I'm Wadulo Mark Arnold.
And I'm Lydia Lakonyero.
And I'm Samson Kasumba.
Thousand 351 COVID-19 cases. This number has pushed health facilities, including the National Referral Hospital in Mulago, to the brink. The health workers say they are overwhelmed and the cases becoming severer with each passing day. Zahara Namuli, in this exclusive visit to the intensive care unit of Mulago Hospital, tells a story of worry.
Like many countries, Uganda has not been spared from the second wave of COVID-19 that is sweeping across the globe. In Uganda, this wave appears to be taking its toll on children and youths.
We are having 70 patients plus. You see, even outside, we are already having 5 patients waiting to be admitted.
When we visited Mulago's intensive care unit, medics were seen pacing up and down to tend to the 14 patients on admission, among them an old child.
The less severe patients, they require some amount of oxygen.
So I can assure you the disease is still severe.
At the time of the visit, 4 of these patients' conditions was worrying. 24 hours later, the Mulago Matthias Singura, who had been in the intensive care unit for the last 26 days.
Another one was there for 1 week. Another one had been there for, I think, 2 weeks. So somehow different people respond differently because 26 days was really low. It was quite a long period.
Dr. Joyce Kalunji, the head of the intensive care unit Mulago, reveals that unlike the first wave, this is traumatizing.
COVID is real and it may not necessarily affect the people we think it does. That's the older, maybe patient with a lot of, with long-standing illnesses. It's a sad reality for a doctor that works in the intensive care unit because all those patients that die sort of stay on our minds.
The Director General Health Services in the Ministry of Health, Dr. Henry Mwebesa, reveals that the numbers of infections are on the rise. In the first week of May, 411 cases were confirmed last week.
That shows that the situation is now getting out of control. We are getting back to those bad days of October, November, December last year.
Dr. Charles Solaro, the Director Curative Services, notes that the cases had run from Kampala, Oyam, Kiriandongo, Gulu, Wakiso, Amuru and Masaka. In less than a month, facilities have opened to manage COVID-19 cases. Statistics from the Ministry of Health critically ill. UMC has 7 patients, 2 severely ill and other 2 critically ill. He has 16 with 1.
No social distancing, so we got ourselves in this trouble, ourselves.
Even if we tell you we have beds, COVID still kills. We get mortalities. And when we bring you in, it's not a guarantee that you'll get well. So the best thing to do is to avoid the infection.
The Ministry of Health is going tough on private health facilities that have instead stuck to extorting money from COVID-19 patients and later dump them at government health facilities.
We don't want to deny people to admit COVID patients because we know the burden is big and you don't have to monopolize it. So if a facility is private that has the capacities and the resources to manage COVID patients, we are very happy with that because it reduces the strain on the burden on the public health facilities, especially as the cases grow bigger and bigger.
The Ministry of Health will be opening all non-traditional isolation facilities like Nambole as Mulago Hospital sets up a post-COVID care center to admit COVID-19 patients. East African community health ministers will come up with regional response plan in light of what's happening in the region. And when numbers exceed the capacity of healthcare providers, the Ministry of Health says they may consider a reversal of a strategically tailored and phased return to lockdown.
Now, the story of worry that you just watched has something to do with the laxity when it comes to adherence of SOPs. Lydia has more of this.
Thank you, Rita Kanya. Now, still in the news, the Ministry of Health is growing increasingly concerned about the level of non-compliance to standard operating procedures when it comes to the fight against COVID-19. Now, in some of the country's most populous areas, such as Kampala, downtown Kampala, you find people are not wearing masks. They're not washing their hands or even social distancing. Now, the ministry says they will have to adopt some harsh measures in order to enforce compliance. Now, UBC reporter Robert Onyango filed this report.
In July 2020, government relaxed the COVID-19 standard operating procedures to a few business entities, which orchestrated the gradual opening of the economy. In downtown Kampala, business arcades and malls were among those given the green light to resume operations, but with terms and conditions.
They were given and wearing masks, but as time goes on, people are now reacting.
However, massive gears in the fight against the deadly COVID-19 pandemic.
It's upon our lives. Like some of us, our bodies are of high immunity, unlike that of Europeans. But also COVID has hit us hard.
I cannot tell the president to impose a lockdown again, but seriously, our people are big-headed.
This is Lumu Street, one of the busiest business access routes to the city center of Kampala. Here, many city dwellers try to get through the city center. In some worst scenario seems to be that COVID-19 standard operating procedures are on a holiday, as you rarely see people putting on their face masks or even washing their hands.
This kept on lowering down. This is a question we posed to Mpaji, one of the local leaders in the session of Kampala arcade operators.
As we are told about the pandemic, that people are going to die, so many people are going to be infected, these people are now reacting because they have not seen it as people dying in masses.
Besides malls and arcades, similar flout of COVID-19 standard operating procedures such as hand washing, putting on face masks and social distancing are witnessed in the transport and market sector.
On our stages we have water, as you see in the background, and that is a very big problem. We tell them that before you enter our taxis, you first wash your hands. They refuse.
The challenge is that at first people were very scared because the virus had claimed many lives, not only in Uganda but in the entire world.
They have this saying that there is no corona. And those ones you cannot throw them away from the what? From other people. You cannot deny their chances of entering the market.
If we do the same thing today, arrest people, take them to courts of law, and people are not learning that COVID is real. So I think there is need to not only enforce these guidelines, but also to educate the people. That is not the work of the police to educate the public about these dangers.
Although the general public, especially the business industry, carries the highest percentage of blame for the surging COVID-19 cases and death, to others, the enforcement agencies have no justification for their indiscriminate standard operating procedure enforcement.
We have a bar around Shell Mengo. It is nearby Lunguja police station, but the bar is always operating freely until morning.
We have at all times made sure that we enforce, and officers who have shown negligence, whenever we get information, they are dealt with in accordance with the law.
Irregardless of who the messenger can be, the reality remains that there is no angel to spread the gospel against COVID-19, but rather a spirited fight against the visibility of mass graves should and must be a responsibility of me and you.
Now that's just an example of the level of laxity in the country as we fight COVID-19. Over to you, Mark Wodulo.
Thank you very much, Lydia. Now, in a development, the Ministry of Health is ramping up efforts in getting the vaccination exercise rolling out into the country. Now, as we speak, efforts in ensuring that the vaccine gets understood by the people. Of course, making sure that these people get vaccinated, and also ensuring that those that are already positive with the COVID-19 are not getting worse. Let's take a look at what Edward Muhumza has to say.
The vaccine is here.
200,000 of the 964,000 AstraZeneca vaccine doses received in March have been used, representing 61%, most of it used for the first jab.
That should have been taken up. So we have been a little bit surprised by the lack of enthusiasm.
Health Ministry officials say this number is low and more people need to take the jab.
We have vaccinated many, but at least you've not had anyone with really serious if it doesn't, but it does. Research has shown. But you need to have the vaccine early enough, not in the middle of the pandemic.
The Ministry of Health and different experts blame the low uptake on anti-vaccination propaganda that has caused fear among citizens, even the most vulnerable. But as the country experiences a new wave of COVID-19 infections, there are renewed calls for people to go out and get vaccinated.
COVID-19 kills, and the opportunity that you have, an effective vaccine, should be taken up by all individuals that are eligible at this point in time to take up. Last week also, we started scheduling the second dose.
The safest period to get a second jab it ranges from 8 to 12 weeks. Initially, we communicated 8 weeks because we know people they relax.
However, the latest reports from up-country vaccination centers show the number of those showing up for the jab has gone up, ostensibly because of news about the resurgence. The ministry has a target vaccinating 22 million people in a phased manner, with each phase planned to cover just over 4 million people aged 18 and above. As government looks for alternative suppliers after operating procedures introduced to curb the spread of COVID-19.
I think let's just maintain the culture of SOPs, even when you have been vaccinated.
Now, with the economy wide open, where you have to run up and about every day, scratching for a living in crowded places, which is dangerous, not to say that you can't or should not follow the standard operating procedures, doing it to the latter may be a challenge. This means everyone's safety may largely depend on whether or not you and people around you are vaccinated. That's if the vaccine is available.
Now, to understand where we are with COVID-19, we want to be speaking to those who have the information. And this evening, we're very lucky, or you could say, we are chanced to have the chair of the Science Advisory Committee on COVID-19, Dr. Misaki Wayengera, who is with us this evening. Doc, a very good evening. As far as COVID-19 is concerned, where are we at as a nation?
So we are at a very worrying situation. We have a situation that is very rapidly evolving and could potentially turn chaotic. Just to tell you a little bit, it took us about a month to have numbers raised from 20 to 50. and 350 cases just in a week.
It is a worrying situation, but if you're going to deal with it, then you have to need resources. Yes. What kind of resources are available for us as a country to do what you could call pushback against a pandemic?
So number one thing is our history in terms of dealing with pandemics. We rapidly set in place a structure for response to the COVID-19, which structure is of course commanded by the President himself. We have the Prime Minister's task force under whom we have several things, but that's more operational. We've built capacities for surveillance, we've built capacities for contacts, for community engagement and communication. And unfortunately, of course, no country can ever have enough resources for the response.
Well, no country can have enough resources, but are we in a place where we could say that not too bad resource-wise shortly?
It is a balance. We're looking at a situation which could easily go out of more or less. We're looking at an equilibrium situation. It could go either way. If the numbers continue rising uncontrolled, we could easily run out of the capacity that we've built.
Okay, very briefly, many are concerned over the idea of lockdown or no lockdown. Is a lockdown something considering, looking at what some have even called belligerence from the public?
Well, at the end of the day, one of the disturbing things is that we have a disconnect between and the messages that we're sending out. And that becomes unfortunate because the response in terms of public health control of the pandemic needs to be a relationship between us, the technical people, and then the public. But unfortunately, we're not seeing the compliance coming from the public. And in such times, if we are threatened by a situation where our capacities will be overrun, we have no option but to close down. These are decisions that we've seen the UK take. We've seen Kenya take these decisions. We've seen India fail to take these decisions, and you can see the situation where they are, and we don't want to get there.
Thank you very much, Dr. Misachi Wayengera. He is the chair of the Science Advisory Committee for COVID-19. You have it there, out of the horse's mouth, so to speak. Now, Uganda has registered 44,000 cases of COVID-19, with 359 long buried since COVID-19 ever showed up in the country. Now, as the country does enter into the second wave, experts are warning that the numbers could be higher than the first time, with more impact on those affected. In the next story, the New Vision newsroom does used in treating those who are lucky enough to survive the deadly one.
Lillian Grace Achen was among those at the front line at the COVID-19 treatment unit.
A new disease. So when we are told that now we are going to receive the first COVID patient, we're all like, I don't know how the disease looks like. It was so traumatizing. I was mostly alone.
Dr. Shafiq Mugerwa was on duty when Chirudu Hospital received its first COVID patient. A few days later, he too was diagnosed with the illness.
I was diagnosed positive of COVID using COVID RDT after experiencing symptoms like sore throat, runny nose.
Emmanuel Safari got the news of the global pandemic while on a business trip to Dubai. Days after his return, Safari was shocked to see armed men and medical workers dressed in astronaut-like suits come for him at home. His family members feared they would never see him again.
They had come to pick me up. Said, picking me for what purpose? He said your results came out as positive.
The COVID survivors emphasize strict adherence to the health ministry's SOPs if we are to fight the ever-mutating coronavirus.
I urge you all people, both old and young, if it's possible, please go and vaccinate.
get the vaccine because it will protect them from going into a severity of the disease.
A walk through the intensive care unit at Mulago National Referral Hospital gives one a horror-like feeling. Isolated and sedated patients fight for their lives. In the intensive care unit are people on oxygen tanks. There is a swarm of beeping monitors and vibrating devices, supplemental oxygen and unrecognizable faces of medics in masks. With many regional referral hospitals lacking functional ICUs, the situation at Mulago is expected to worsen. This is because all critical patients will likely be sent there.
When you're fighting a pandemic as serious as COVID-19, gatekeeping becomes a serious conversation. We are now taking the conversation to border points with Rita Kanya.
Well, we start off that conversation at the Uganda-South Sudan border of illegal positive cases of COVID-19 have continued to rise. Now 23 cases have been registered at the Lego border point alone in a span of 14 days. There is also about 160 cases in Amuru and Gulu, sparking fear of a second wave of the COVID-19 pandemic. Benson Ongom has a report.
A Lego border point at daytime, the entry and exits are barely guided by the COVID-19 SOPs, a likelihood of a bigger pandemic threat to the country.
This month alone, there are 23 positive cases coming from the border. They have been able to confirm to us that the number of COVID-19 each and every day is going up. But the biggest challenge that they're faced with, the people who test positive for COVID-19, there's nothing they can do with them. They have to advise them to go to their homes. But again, also they have said there's a huge challenge because to trace them is a big challenge. But the question of testing as well is one thing, because if you look at the border, how it is, just look at it.
The situation is worrying that people are tending to get relaxed in observing standard operating procedures, partly because the communities are mobile.
These are people who keeps moving each and every day. So when you're doing sensitization, it is always no more. Again, you're seeing a new group of people coming in.
Along the borderline, we have not taken our step of going for community sample testing or random testing. We would get the scores of this infection within the border district like Amuru.
The new area we are now getting up, we are getting into is foci of infections in schools. Recently we had Gulu University with 17 students who actually had COVID. And then other smaller schools are cropping up, especially secondary schools.
Being at the border, what comes into the mind is the capacity of testing center, as many fluke their way into the country. This then raises the question of management of truck drivers and refugees coming to Uganda.
When you are found positive, they will just leave you to go, but only warning you that you are positive, have your certificate, go, you are positive, because it is asymptomatic. But this is not what is enclosed in the community outreach strategy.
Last year at the peak, we had a big number of staff supported by Red Cross and other partners here. But now the staff base has reduced. So meaning enforcing compliance around the customs area here and then the community still remains challenging.
At Gulu Regional Referral Hospital, 9 patients are fighting for their lives at the intensive care unit, a situation that is daring for the medical personnel, according to Dr. Lima Jams, the director of the hospital.
2 very severe, 5 severe, and 2 mild, and the other ones on oxygen. That is as of today. But we still also have people in community care or home-based care. But the unfortunate bit now is there's a lot of complacency. That okay? Our people tend not to care.
The home care treatment has become untraceable for the health teams from the border points, but even the few that the medics keep tabs on, a bigger threat the hospital and the health workers are worried of.
People have all gone to the effect of giving us wrong addresses, totally wrong addresses, to mislead the health worker. People have gone ahead and deliberately, instead of isolating themselves and staying where they are supposed to be isolated, gone into the community.
With numbers soaring and people declining to take the COVID-19 vaccination, there are calls on government to improve sensitization at the border points.
Our health workers too are not taking up the vaccines. Imagine out of the 500 people I have here, both health workers, clinical staff, and that means the support staff too. Only out of the 500, only 212 have taken the vaccine.
We need to do a massive testing right now, because you see our focus is on the travelers, but we are not testing majorly the community. So we don't know the in-depths in the community.
Well, there you have it. The cases of COVID-19 are growing exponentially across the country. As we end this special joint broadcast, we reiterate the measures put in place by the Ministry of Health to prevent the spread of COVID-19.
To be doing is having a COVID-19 test as soon as possible. And the technical crew, I'll finish off by saying that there comes a time when we hear a certain call, to lend a hand to life, the greatest gift of all. Let us return you back to our respective newsrooms for a continuation of this bulletin.
More medical staff and supplies and further exploration of new treatment approaches made it possible for many critically ill patients like Mr. Chung to recover. In the survivors, the immune system, given the opportunity to respond properly, helped to defeat the virus, increase the recovery rate, and lower the mortality rate. These aims were achieved through an intense battle against COVID-19.
24个小时没闭过，我一怕眼睛一闭合，人过去了。总想到自己有个家，想到儿子姑娘，总想睁着眼睛。
有时生命其实有时候是很脆弱，但有时候呢也是很坚韧的。对这个新冠肺炎病毒，它的认识我们也是逐步加深，艰难的迈出了第一步，未来可期，病亡率一定可以逐步降下来的。
Late January and early February was the most punishing time in China's war on COVID-19, when the number of new cases in Hubei and Wuhan saw a rapid surge. Sorrow and grief swept Wuhan as people said goodbye to loved ones. A 90-year-old grandmother, a Mrs. Xu, expressed her anguish in a letter to her 64-year-old son. "My dear boy," she wrote, "please hold on and be strong. You'll defeat this disease." By now, every hospital bed in Wuhan was occupied. For 4 days and nights, Grandma Xu watched over her son.
我常规的问他，我就说您有哪些不舒服，有没有发烧，有没有咳嗽之类的。然后他说他并没有发烧咳嗽，他是陪着他是儿子过来看病，他毅然决然的选择他自己一个人来承担照顾他儿子这个责任。他说 我已经这个年纪了，我已经无所畏惧了。
On the afternoon of February the 4th, her son was admitted to the ICU. Now she could do nothing to help him. So she borrowed a pen from a nurse and wrote a brief but heartwarming letter of encouragement to her son on a page of his test report. Tragically, the old lady's son passed away later that afternoon. The doctors were distraught, and the grief-stricken family members couldn't bear to tell the 90-year-old the sad news until much later. At the height of the